I had went on a little 5-day vacation with a group of girlfriends, and I came back feeling rested, relaxed, ready to come back to work. So the first thing I always do when I come back from a vacation is I meet with my management team. And as I was talking to them, I could see the two ladies looking at each other, and I also thought, I don't think I'm making sense. And then later on, I walked out of the office and I went to speak to my PACS administrator, Mark Mann, and he immediately said, "You don't look good." And I'm like, "It's really spinning. I feel dizzy." And that's when he said, "Sit down." And then one of the radiographers who work in our department came to me, and they know my normal, and they said, "Oh, you don't look right." And so they called the emergency room, and they immediately took me to the emergency room for treatment. So everything that we review at Stroke Committee, we review data, was happening to me. I was having my CT scan done. I had the emergency room nurse with me, the emergency room doctor assessing me. So I kind of lived everything that I have been involved with for years. I had a trans-ischemic attack. I was lucky. I did not have any permanent brain damage, but I still was assessed to make sure I didn't have any other symptoms within 24 hours. All that we talk about in respect to the treatment of stroke patients. I knew I was at the right place for the simple reason I know how hard our stroke team works. I know how dedicated they are from the time the ambulance crew comes in, care management of the team that's in the ED to make sure that you're taken care of. The emergency room nurses were excellent. They're all trained in all the things you need to do. Everybody that I sat with on this committee was involved in my care, and so I think that we have wonderful care here at Meritus Medical Center.